The Center for Excellence in Limb Lengthening and Reconstruction here at Scottish Rite is a patient-focused, multidisciplinary approach to the care of the child. It is using the talents of orthopedic surgery, nursing, psychology, physical therapy, coming together to create a plan to help a patient through what can be a very long and complex treatment for limb lengthening or reconstruction of either the upper or lower extremity.
Many of the things we do as orthopedic surgeons, we go to the operating room, we do our procedure, and we're done. With limb lengthening, it's a process, and because it's a process, it requires a team to work together to help the children through the process.
I think Cellar at Scottish Rite Hospital, it's a great model of a modern clinical research entity because it's combined everything necessary to provide treatment to those patients in the highest level possible and be adaptable based on the individual needs of those patients.
We are working on innovative ways of fixing the leg with new fixators so that we can lengthen and correct angular deformities in children's limbs both more quickly, perhaps more comfortably, and with a more stable frame. These frames have been under-designed by our research team here in the Cellar, which is comprised of Mikhail Samchikov, Alex Cherkashin, and David Ross.
The Elizarol system that was developed a number of years ago has had a major influence on the work that we do, but our research team has taken that to a different level with a system that we call the TrueLock system.
Drs. Cherkashin and Samchikov offer a very unique perspective and experience with planning these procedures. They've developed unique software to help with the planning of these procedures.
Together with Mikhail, David, we involved in designing of new hardware. By hardware I mean new frames, new techniques, new methods of doing the Elizarov treatment.
In dealing with complex deformity, whether it be congenital, acquired, or even traumatic deformity, we have three primary tools that we use when we speak of external fixation. So what we call the TrueLock external fixator is the classic ring external fixator that we've used for lengthening and deformity correction for many years. The TrueLock Hex, which is the external fixation with the hexapod, which has the 6 struts and the associated computer program to help with complex deformity and lengthening correction, is sort of the next generation, what we consider the state-of-the-art of external fixation for deformity and lengthening correction. And then we were also lucky enough to have a specifically designed external fixation set for complex trauma. We call it TrueLock Trauma.
The benefit of these external fixators is they allow three-dimensional correction of deformity and/or length that can be adjusted on week-to-week or day-to-day basis. So if you realize you need a few more degrees of correction, then you can program it in and achieve that without any further invasivity to the patient.
The second method that has become very popular that we use for skeletally mature patients with lower extremity leg length differences is an intramedullary rod lengthener.
So a rod that with a screw mechanism will lengthen itself via a magnet, and we can subsequently increase length in a child's long bone without requiring necessarily large external fixator devices on the leg, and that's generally more comfortable and better tolerated for the patient.
The incorporation of 3D printing into the everyday care of patients has really been a revolution for us in the sense of being able to visualize, and not just visualize, but to touch and to feel and to be able to see what the deformity is in a specific bone or joint. And then we can use that model and manipulate that model to help determine what is going to be the best approach and what might it look like when we're done with a specific approach. We're very lucky at this institution to have very well-developed programs both in limb lengthening and reconstruction and a very active clinic for amputee patients. So when a new patient comes in with a very big leg length discrepancy or a big congenital deformity, we really make an effort for the family to visit both clinics, because the more information that the family can have, the better off. And we always need to remember that a visit in our clinic isn't a visit for surgery, it's a visit to identify the ideal care for the child, whether it be operative, non-operative, whether it's just something that we're going to focus on with rehabilitation. Maybe it's a plan for what might happen 5 or 10 years down the road, and here's what simple things non-operatively we're going to do for this time before we think something's going to need to be done operatively down the road. There's a lot that goes on into the care of the patient long before any sort of surgery might be necessary. We always need to remember that Scottish Rite is built on multiple pillars, and certainly the center pillar of this institution is patient care, and what is it that we can do for the patient to make their life better. And that's really what drives this institution.